This video it will be about psoriasis and how to cure it with food. So the presentation is actually very long, and it has more than 35 links to scientific publications. And so I recommend to download this presentation as PDF file and go to the links and to learn more. And how I present this research, it is like first I investigate what official medical services, medical professionals recommend to cure psoriasis and related diseases, but then I make very short solution to this because just again I cure it. I suffered from this psoriasis myself, but now it is gone, and just I will give you reference what to do and how it is really easy to stop any autoimmune diseases and especially psoriasis. Okay, let's go. And first, as I said, I present official viewpoint. Even if it is shortened, it is official viewpoint. Okay, so leaky gut syndrome or increased intestinal permeability may allow bacteria and toxins to leak into bloodstream and trigger autoimmune diseases like psoriasis. Causes may include chronic stress, sugary or processed food, and gluten. Treatments aim to heal the gut lining by eliminating triggering food and using probiotics and supplements. Crude fiber irritates the gut in some people, and evidence is limited to leaky gut syndrome itself. So it is actually, I believe it is related. And psoriasis involves genetic and autoimmune components. Gluten intolerance affects up to 6% of the population, and gluten can damage the intestinal lining of sensitive individuals. However, data is lacking on gluten-causing leaky gut syndrome in some asymptomatic people. Psoriasis causes rapid skin cell turnover, leading to plaques. This summary was prepared with artificial intelligence, so it is not so nice probably, but okay, if you want to learn more, go to the presentation and big presentation. So here we see picture presenting inflammation in the lining of the epithelium layer in the guts, and when it is leaking, then all these substances can go to the bloodstream and then they cause autoimmune diseases. Psoriasis is considered by official medicine as incurable, but treatments aim to reduce symptoms as always. Okay, it is not official medical care does not cure diseases, it is just reducing symptoms. Anecdotal carnivore diet reports describe the alleviation of the autoimmune conditions like psoriasis. Yeah, anecdotal, okay, but it works. While a leaky gut may play a role in some autoimmunities, more evidence is needed. Okay, this is again official opinion, and so it is. It's not the same what I think. Psoriasis is a chronic skin condition marked by rapid skin cell turnover, and it has historically associated with social stigma due to misconception, and in past it was considered as a lepra, and so it is again was very big problem. The disease involves an accelerated production of skin cells, leading to raised scaly plaques and localized skin aging. The severity of psoriasis is determined by the percentage of affected skin, classified as mild, moderate, or severe. Conventional treatments encompass topical agents, phototherapy, systemic medications, biologics, some small molecules, and some small molecules inhibitors, all aiming to reduce inflammation and keratinocyte proliferation. Okay, so sometimes again it is very severe. I didn't have to such extent, but I suffered quite severe psoriasis. Now it is gone. Why I was suffering from psoriasis? Because I was eating too much fruits and vegetables. This was the cause. Okay, however, these treatments often offer incomplete clearance, and relapse is common. Psoriasis is linked to comorbidities such as psoriatic arthritis, obesity, cardiovascular disease, and depression. Additionally, patients on immunosuppressive treatments, which is very common, face higher risk of infection and death, of course. Recent research suggests that a connection between gut microbiota composition and psoriasis pathology. Probiotics that increase short-chain fatty acid production in the colon have shown promise. Some foods may worsen psoriasis, while others may help improve it. Anecdotal reports mention the potential benefits of very low-carb carnivore diets for psoriasis. Okay, anecdotal. Okay, so nobody tried to make clinical trials because no profit will be from this. But psoriasis itself, it brings a lot of money to the pharmaceutical industry. Okay, however, mainstream medicine largely hasn't embraced dietary changes as primary treatments for the condition. Nail psoriasis, it is again next complication, is a common but poorly understood condition affecting 80-90% of psoriatic patients at some point. It can lead to severe skin and joint issues, causing pain, social stigma, and reduced quality of life. Nail psoriasis can affect both the nail matrix and nail bed, leading to issues like pitting, chipping, white and red spots in nails, and detachment of the nail plate. Treatment nail psoriasis is challenging because of the slow nail growth, which often leads to neglect by doctors. Again, it is considered not curable. Traditional systemic therapies can be effective but come with side effects. Newer options such as apterimilast and tofacitinib show promise. I don't recommend to use it. Psoriatic inflammation in the nail bed can cause changes like hyperkeratosis, onycholosis, I don't know what it is, but in splinter hemorrhages. Okay, again, I don't know, it was prepared by artificial intelligence. Potentially leading to secondary fungal infection. So it is really very, very nasty disease. How it develops, you see the nails are damaged with this psoriasis. And okay, from the perspective of carnivore enthusiasts, it is their firm belief that mainstream medicine unjustly labels psoriasis as an incurable chronic ailment due to its reluctance to acknowledge the potential curable power of diets. Again, they call it anecdotal, but again, medical officials, they never consider diets as a way to cure diseases. Furthermore, this enthusiast like me argues that funding for research exploring the potential of a carnivore diet and ketogenic diet as a solution for psoriasis is practically unattainable. So it is impossible to get money for this research because, again, how pharmaceutical company will get money from this, and the clinical trials are very expensive. Okay, drawing from my personal experiences and the shared convictions of numerous proponents of the carnivore diet, it can be confidently assessed that psoriasis can indeed be managed through dietary adjustments. The preferred approach, often referred to as exclusion diet, demonstrates its greatest effectiveness when all other foods are eliminated from one's regimen, leaving only beef seasoned with salt. This is beef and salt. It is this very, I mean, quite maybe too much, but okay. For those curious about this approach, download presentation, you can click on the links or Google it, and then you can watch videos on Michaela Peterson channel. And Michaela's story is one of the overcoming severe autoimmune conditions, including this psoriatic arthritis or rheumatoid arthritis that led to the replacement of her hip joints with artificial ones. It was only when she embraced the exclusion diet, so only eating beef and salt, that her life began to improve, allowing her to get married, give birth to a daughter, and actively advocate for this dietary approach. Similar narratives can be found in the life of Amber or Hearn. I also recommend it because she has very special viewpoint that not only beef and salt, but we have to rely on animal fat and especially butter. Yeah, this is again, it works, guys, it works. She's really smart, despite she's not a medical professional. She's in computer business, but okay, she's very smart. While it is true that that only a handful of physicians openly endorse the carnivore diet, notable individuals such as Dr. Paul Masson, not Pavel, but Paul, pardon for misprinting. Paul Masson, and I like him very much. He's a great man. Also, medical doctor Paul Saladina. Oh, sorry about this mistyping. Dr. Ken Berry and Dr. Lisa Widerman. I'm on the ranks, so you can click on the links and read more. Maybe follow these people. I highly recommend it. It's even if I not follow the Paul Saladina completely, I more support the opinion of Amber or Hill. Here, but okay, these two people are maybe the best. So critics within medical community often dismiss these dietary enthusiasts as self-proclaimed nutritionists to accuse them of being deceitful. Okay, again, I don't care. If people follow official medical recommendations like Harvard University recommendations of healthy food, let them go, because it is what they propose. It is something, from my viewpoint of professional scientist, it is absolutely insanity. But again, my main goal is my own health, my own longevity. So I don't care about opinion of other people. But these people I trust and recommend to consider opinion of these people. If not, okay, follow the official medical professionals. Okay, as you see, I just will go through this presentation, and you will see it's a lot of slides, a lot of references, because I was going and I was reading scientific publications, what is important, what is available, what we can do, and to understand what is the situation and about everything. So here no pictures, but you see that a lot of references to publications, and that's again. And what else I didn't tell in the beginning, there is a problem with fungus, growing fungus or toenail fungus. It also can be a consequence of psoriasis. Okay, but it's also curable, but you have to be more careful about hygiene. Okay, then again, you see these references, and some references even not mentioned here. So it is again a lot of work. For me it is a lot of work, and I am happy to say that it is gone for me. I'm fine. There is, and to my opinion, again, if you want to extend your lifespan, that autoimmune diseases is a key point, because if your immune system is overloaded with these problems of leaky gut syndrome, you cannot extend your lifespan, and you cannot fight autoimmune diseases. You cannot fight even infections. So this is so important to keep your body protected, and the only way to protect it is with following this ketogenic diet with complete exclusion of plants. Maybe coconut oil would be okay, but all the rest is only spices can be used. I use spices, sure, but again, so it is again up to you what to do, and you can decide for yourself. And the standard disclaimer that I'm not a medical professional. I'm not supposed to give you medical advice. I express my opinion. I'm scientist. I'm doctor in science, and especially I'm doctor in physics, not in medicine, even not in biology. But biology is my passion. and I invested a lot of time in biology. I like it, and especially I like it because it is relatively complicated and only few people understand it, how it works. But if we understand it, we can do miracles. For sure, we can do miracles. Okay, please support my channel by pressing like and bell button, subscribe to my channel, share this video with your friends, and download the presentation. You will learn more. But again, if you will not follow my advice, then no problem for me. It's again, I trust these people. You can go to links and read them. But again, it is only handful people I can trust. Only handful. Most of the physicians are subject. Okay, so sure, official medical professionals are in business. To make you sick and to keep you sick. It is my opinion. I never getting sick last 25 years, and never need any advice from official physicians. I don't care. It is not that I appreciate the achievements of the pharmaceutical companies. I appreciate a lot, especially this recent vaccine. It is piece of art. It is so smart. But only I would never and ever allow to make a jab of this vaccine to my body. Never. Because I know how it works. I know the consequences, and what is also good for me. I have O negative blood, and with such kind of blood, I am naturally immune to viruses from the group of dengue viruses, and this COVID virus was from the dengue group, and dengue group viruses are absolutely deadly. They are so special, but again, how they selected this virus, how they made this vaccine, which is artificial virus actually. It is piece of art. It is high science. If not consider that it is bioweapon, okay, this is so high level of science. Yeah, okay, indeed. But okay, science can create weapons. Science can create cure. So it's again, don't blame scientists. It is actually politicians decide about you and how to use this or that tool. Okay, that's all. Thank you again for your time, and have a wonderful day. Ciao, ciao.